Hey everybody, Dr. Rob Silverman here, host of Proven Health Alternatives. I'm here with my good friend from Erchonia. I'm going to get it right. International Sales Manager. And we're going to go through that. Joseph Zapolsky.
International Sales Director, but you were just right there, Rob.
Oh man, guys, if I just get fired, get the hat and ready. I got to start collecting or the boot in the firehouse. I'm in trouble. Look out. Joe,
hey, don't worry. It's all just a matter of titles. My job is just to do what I can to help out at Erchonia and take care of everyone out there.
You got it. And you know what? I'm happy you said that. On a serious note, you guys do a great job. Your laser has revolutionized my practice. It's touched so many people in a health way that I can't tell you. And, I got the laser for myself because everybody knows I suffer from torticollis. We get a lot of inquiries. What does Rob have? What is he doing for it? And I wasn't able to get chiropractic adjustments anymore. So one of my friends said, you got to try this laser. And I tried the laser. I was like, oh my God, this is great. Tried it on my wife, tried it on my friends and family, put it in my patient base, started to get great results, synergistic with any chiropractic treatment I was doing, ART, factor, decompression, exercise rehab. Met you guys. You were kind enough to put me on the team, and team turned into sort of more than friends, almost like a family, if you will. And I do appreciate that. I mean that from my heart. But you guys have done so much in your lineage to help people in a health way. I want to say for everybody, thank you. And I also want to see if you guys have any questions, what the laser does, what's the history of it, how they can get it, whatever you want. Joe is the guy. So with that said, why don't you give a little bit about your history?
Yeah, absolutely. And Rob, it's great to have you on the team. Like you said, Erchonia, we really do pride ourselves in being the Erchonia family. As you know, but all the listeners might not know, it is a family run and privately owned business. So not only is the business run by a family, all the doctors that lecture on our behalf, all of the international distributors we work with, all of the vendors and partners throughout the U.S. that supply us with things, we try to make it a family, the Erchonia family. A little bit about myself, for those of you who don't know, I now direct our international sales. I work with my counterpart. He's one of our founder's sons, David Tusak. He directs the domestic sales. I've been with the company now 20 years this past February. Obviously, you're starting to see a little gray in the beard, so I'm aging myself there, but it's been a wonderful journey to see the company grow, to see how many things we've done to be able to help people in different fields of medicine at this point. It's been astounding. And it's really been a fun journey for me personally, Rob, because not only have I seen the company grow, but I got to grow as an individual and as a professional. I started back building our adjusters in the assembly shop 20 years ago, doing soldering, drilling and tapping screws, putting the devices together. And throughout that time, went to work in the machine shop. At one time, ran our service and repair department, which I built a lot of great relationships and a lot of great doctors interacting that way. And then from there, went into sales and research. And now my current title of directing our sales force.
International sales force.
International. I'm working on growing that. We want to spread the love worldwide.
I got to tell you, if you know when I make my mistakes, how I get chided, this one is going to be for at least 18 months. I'm done. I'll be shaving my head for asking for forgiveness.
Don't worry. I just shaved mine right before I came on, so I look pretty for everyone.
Erchonia, without question, and what's attracted me most is the science and the research. So you guys have 20 out of 23 of the FDA clearances. So could you give some people a little background on that, like a couple examples of what FDA clearances you have and what really goes into that? Because people say, oh, it's 20 out of 23. What's the big deal? It is a big deal.
Yeah, absolutely. And I'm glad you touched on that, because one of the crazy things when I started with us, speaking of that journey, is our owner and president, Steve Shanks, always used to say, I got the hardest job in the world. I'm shining this light on somebody. Most people don't feel anything because it's non-thermal, but I'm telling you, it's going to heal you. And 20 years ago, people were laughing him out of the room going, this is ridiculous. But his passion was for research. So he started looking to prove how the lasers work through level 1 clinical trials, the gold standard of research. And with that, use those clinical trials to garner FDA market clearances. So not only does it prove the safety and efficacy, but it allows a doctor, a physician who purchases the laser to market for that specific indication. So we have different indications like chronic low back pain, plantar fasciitis, neck and shoulder pain. When you get on the aesthetic side, the treatment of acne, onychomycosis for nail fungus, and non-invasive fat loss, which has been a huge industry for us and really helped us get our name on the map in a big way. And when you spoke about what goes into that, there's a reason why other companies don't have it and why we have 20 of the 23, because it takes a lot of blood, sweat, tears, and money to get it done, because you're setting up research sites all across the country. You're going through stringent processes such as IRB and FDA pre-IDE meetings to make sure that what we're doing is by the books. And like I said, the gold standard of proving that these lasers are different than other lasers and that what we say they're going to do, they're really going to do.
Yeah, without question. So the FDA clearances that come to mind, number one, you've got an FDA clearance, and I think it's, well, it's actually not that guy back there, but the FX 635 and 405 has an FDA clearance for full body nociceptive musculoskeletal pain. So what that means in layman terms is if you guys want to come in my office or any Erchonia office that has that laser, it's any body part, any muscle. You also have an FDA clearance for over the body contour, which speaks to what you said in the Zerona. And you also have an FDA clearance for the Emerald, which I think you may want to give a little fill in for that.
Yeah, absolutely. So the Emerald laser, that was the next generation of our non-invasive fat loss and body contouring lasers. And what really sets that one apart is if you look at all the other technologies out there that do some kind of non-invasive body contouring or fat loss, it always comes down to the person having to have a BMI of 30 or less. Well, if you look at one of the epidemics we're fighting, it's obesity. And those are technologies that unfortunately obese people couldn't use as another tool to help them on their weight loss journey as they're looking to get healthy, as they're looking to feel good. And what the Emerald brought into play was non-invasive fat loss for a BMI range of 20 to 40. So in the clinical trial we did, we proved that the tech would work on someone who is considered clinically obese. And it's been wonderful because we just did a live stream for the Emerald on Thursday evening with Dr. Cesar Laura, who does a medical weight loss program here in Florida. And he showed how he's using the Emerald as one of many tools to help these patients on that journey to get where they want to be.
That's outstanding. You also are expanding. Most of my listeners, everybody's got a pet or a dog. You're also expanding in the veterinarian field also?
That is correct. So we're making a major push into the veterinary field. And what we felt like is we've proven now, which other lasers in the vet market haven't, that we have a laser safe enough to use on a human, safe enough for you to use on your patients, your family. And now we're bringing that into the vet world because let's face it, people consider their animals their family. I mean, I'm snuggled up with my Chiweenie on the couch. And yes, Rob, that hurts to admit a little because I inherited the dog from my wife, but she did become a part of the family. So I want to know when she has aches and pains, when she has something wrong with her teeth or her ears, I can use the lasers and it'd be the same lasers I'm comfortable using on my family and friends that I'm using on my pets.
Now, I don't treat pets. Everybody knows that, but I had a friend and they brought the dog in and I lasered their hip. And I have to tell you something. There's something to be said about lasering a dog or a pet versus a human, because if the human is definitely not as receptive to a thank you, whereas the dog lies there and looks at you. And I said, May, I want a dog. But I do have a question for you, and this is going to start the question. So here we go. I'll pop it up. Is the Emerald something people can use at home, or do they have to go to a practitioner?
Great question. The Emerald is a prescription device, so it is something where you have to go to a practitioner. So with all of our lasers, like for the Emerald, it's emeraldlaser.com. You'll go on there and there'll be a physician finder, And based on your zip code and the amount of miles you're willing to drive, you can type that information in and it'll guide you to the closest provider.
Well, I just got a question. Again, I tell everybody I get a lot of text message questions. So the text message question is, basically they asked, is your laser safe? But more so, can it burn anybody? And what kind of wear, like goggles or anything that you have to wear in the room when you get a laser application?
A great question. So a lot of people, when they think of a laser, they instantly think of a James Bond movie. Someone's tied to the table, they're going to cut them in half, or they think of lasers that are used for surgery, for your eyes, to cauterize things or do intricate surgeries inside the body. Ours is a true non-thermal laser. So it generates no heat at all. And that's actually one of the amazing things. We had just spoke about the vet market, but how you can laser an exotic animal, a bird with feathers, a black dog where black normally absorbs energy, and you never heat or you never burn. So there is no way you can burn with our lasers. Now, as far as safety, to me, it's one of the safest products you can use on the market because you don't have the side effects even of some of the pharmaceuticals you're using or things like that. When you're worried about a side effect, you don't have that here. Literally, unless you're shining the laser directly into your eye, you're not worried about anything from a safety side. Now, we do send glasses with the lasers, just so if a doctor's treating anywhere on the neck, the shoulders, the face, the patient can put the glasses on to ensure that that specific wavelength of laser light is blocked out. But other than that, if a doctor wants to put this into their office, they don't have to make modifications to the office. They don't have to put up warning signs. They don't have to have automatic locking doors or blacked out shades because it is a class 2 laser and it's something the FDA considers non-significant risk.
Right. And just to piggyback on what you said, because there's a lot of good stuff to unpack there. There's 4 classes of lasers, or better yet, there's this overriding theme of cold and hot laser. Hot lasers for surgical precision, it actually cuts skin. Everything else is deemed cold laser. That said, a class 1 or 2, no goggles are needed because there's virtually no damage done to the retina of the eye. Classes 3 and 4 heat the area with what we call a longer wavelength and more power, so they vibrate and cause friction. The Erchonia laser doesn't do that because it's based on photochemical responses, or if everybody will take the next step, electromagnetic transfer of energy. And that's where you want to be, just enough energy to get the cell to metabolize efficiently and then cascade throughout. Because guys, as we all know, we've talked about many times on the podcast, the body's all interconnected. And that's a big theme. And it's a laser. It's not a light emitting diode. But we're getting blown up on questions. This is a good one.
Love
Here
questions.
we go. How do lasers compare to drugs for pain?
So they compare because you are able to have the same exact effect on a cellular level that a drug is having. Our owner always says he's convinced that anything a drug can do, a laser can do, because you're stimulating a cell to react in a certain way. That's what the laser is doing. The beauty of it is that you don't have to worry about the side effects. And that's, Rob, when you talked about the FX405 and the FX635, why we're so proud of the technology, because we know one of the main things people are dealing with in this country is addiction to opioids. My wife is a first responder. She works in the hospital, and it's amazing how many people are going through this problem. So if we can offer something that's just as effective as a drug to help with pain, and like you said, now we've been granted a clearance anywhere on the body, head to toe, where you have musculoskeletal pain, you can use this laser and never have to worry about becoming addicted, never have to worry about an overdose or a death, never have to worry about those side effects. It's wonderful. And one of the reasons why I'm so passionate about being at this company and want it to be the only real job, if you will, that I ever worked. I mean, I love caddying before I worked here, but this is my career. And when you get to do something that's really helping people like this, and that's how you're making a living, making good money, it's awesome.
Without question. And, I was just talking to a buddy of mine, a very well-known medical doctor, and I was asking about some of the different drugs, and he looked at me and said, "Rob, drugs have their place. I know sometimes chiropractors don't want to hear that." I said, "No, I get it." He said, "But there's no free meals with drugs. Just like what you said, there are some side effects. It's risk reward." So what we talk about, and you and I have had this conversation, what's the risk reward with the laser? Virtually no downside at all upside. And to speak to what you said, drugs, and they have their place and they're very powerful. They shut off all pathways. We're turning on and shutting off pathways. So what's the difference? What is an NSAID, a non-steroid anti-inflammatory? It does decrease pain, but impairs healing. What does laser do? Decrease pain, but promotes healing. Risk reward. Which would you prefer?
And I agree with you, Rob, and I think you hit the nail on the head. You have to look at how you're going to use both tools and use it strategically. Like, for instance, when I just broke my big toe in February playing basketball, like you said, obviously the first 24 hours, okay, that thing's killing me. I, fractured the big toe in 2 spots. So you're taking an NSAID, you're getting it iced and you're getting it elevated, but that's to get through the initial shock and the pain of it. But then from there, like you said, knowing, okay, that can limit some healing. Now we're through that first key area there. Then from there was very aggressive with the laser treatment and doing the other things that, you guided me in as far as nutrition to help heal it that way. So I agree with you. I think if you can sort through the noise and use the best of both worlds, if you will, it's going to be optimal for patients and doctors.
Yeah, a couple of good points there. Number one, the laser works on its own, but it's also synergistic with any kind of other treatment, especially nutrition.
Yes.
And you guys are not resistant to that. Number two, I think maybe you should elucidate a little bit on what the laser does. Is it pain modification? Is it healing? Is it palliative? Is it curative? Is it both?
It's both. And like you said, when I'll give my toe as the example, obviously starting to laser, it's going to help knock down that pain and inflammation, just like ice and elevation. So you're coming at it with every tool you have in the toolbox. But on the healing side, when I had looked at the x-rays and they're telling me, okay, you're probably going to be out 4 to 6 weeks. You really need to take it easy here. Well, I was at the Parker Las Vegas show 3 weeks later. I did listen and at least wore the walking boot, but by lasering 3 times a day, every day, I cut my healing time down by about 40%. And when I got back from that show, I was sitting at about 3.5 weeks. I was back out there starting to shoot some hoops and starting to test it. So you are seeing both, like you said, the pain relief side and the healing side. On the preventative side, which is one of the most exciting things we're now looking at in the research realm, and what a lot of doctors like Dr. Dan Murphy or Dr. Trevor Berry have been doing as an off-label use, but using while they teach or while they practice, is the preventative side when it comes to brain health and the things that the laser can do there. So that's something we're very excited about as a company and something that we're going to pursue so we can prove through the proper research that that's what it can do to help the brain in a lot of different ways. Obviously, like Rob, when it comes to Alzheimer's, dementia, those things are becoming a pretty big issue as well in our society.
Alzheimer's is the 6th leading cause of death. It causes more death than a combination of prostate and breast cancer in a month. Every 65 seconds, somebody dies from Alzheimer's. By the year 2050, it's been postulated that 50% of the population will have a symptomology of Alzheimer's. The laser is great for imbuing the mitochondria and resetting brain neurogenesis in the brain. And I'm going to take it a step further, and anybody wants to know, please feel free to reach out to me. All neurodegenerative diseases, or the bulk of them, have an origin and association with the gut, and I also laser the gut. So now you're really seeing that the laser works in a musculoskeletal light. It works in, we'll call it a functional neurological light, and it also works in a functional medicine light. So that said, I think James's question is great. What advances are coming with laser research by Erchonia?
Yeah, so we have a couple that we're working on. One of them is going to be a next level for our chronic low back pain. So the original one was done by scales that the doctors and the patients use to measure the pain rating of the patient and the functional movement of the patient. But what we're doing now is we're adding blood draws into the new study. And what we're going to do through those blood draws is analyze all of your main markers for inflammation, interleukin 6, interleukin 8, TNF alpha, reactive protein. So we want to show that, okay, here's what it looks like through blood work before the laser treatment. And here's what it looks like after the laser treatment. So not only are we showing an improvement in the patient's pain based on their rating, the movement based on the doctor's rating, but now in the blood markers to show a decrease in all your major inflammation markers.
Yeah.
Go ahead, Rob.
No, I'm sorry. The inflammation stew, it's hot. So here we've got interleukin 6, which is such a dynamic marker. Interleukin 8, another marker, TNF alpha. Interleukin 6 is shown to be attenuated best with the red laser, 635 nanometer light. Interleukin 6 by a 405 violet light. The interleukin 8 does a little bit better with the 635. The combination of the different colors, which we can discuss. TNF alpha, again, is the trigger for inflammation. Now, what you're doing is you're lasering, so everybody knows, at the lumbar spine, and getting a systemic effect with objective markers called blood markers. So clearly the laser is not working just in a localized area with the pain. It's also working in a systemic area. When that comes out, that's really going to be a breakthrough study. So someone has a comment on that. Let's go share that. I think that speaks for itself.
Yeah, absolutely. I mean, that's what we're working to. And I think I agree with that comment wholeheartedly. It's going to be truly amazing, Lord willing, if that proves out.
So we have another one. Angie says, what type of doctor would I look for in my local area for this? Who carries the laser?
If you're looking, you can go on Erchonia.com for that specific type of treatment for pain management, low back pain. There'll be a physician finder there, and you type in your zip code, how far is okay for you to drive, and it'll pull up physicians of all different disciplines, medical doctors, chiropractors, acupuncturists, who all use the lasers, and you can go to whichever one is closest or that you prefer.
We've got another question. Where do you go to learn about laser classifications? They are confused. And then I'm going to piggyback question number 2 on that. What after the classifications, I want you to address what's the difference between a laser and an LED?
So I'll start with the laser and the LED, because like you said, everything has its place. So a lot of people see LED devices out there. And do LEDs work? Yes, but not the same as a true laser. Because if you think of an LED, you're getting scattered photons going every which way. When you look at a laser, all the photons are traveling the same way. So they're coming directly in and you have much more focused energy. And to give an example, because a lot of people tell me, well, what's the difference? We talked about our studies earlier, Rob. When we do a level 1 clinical trial, it's multi-site, randomized, double-blind, and placebo-controlled. When we do the placebo, we are using a LED of the same color that we're using a laser as the real device. So our sham is LED. Now, do we get a result? Yes, the placebo does get a result, but typically in these clinical trials, the laser is getting 6 times better result than the LED or the placebo.
Without question. And as you know, I did an FDA clearance for what we call the EVRL, Erchonia violet red laser. And what we used as the standard was the FDA clearance for the Accelerate, which is a great tool. So you guys said, all right, let's see, red light works better than anything. Does red and violet work better? And we found out that the combination at the same level of power and wavelength, when you add red and violet, work better, because we know red's musculoskeletal and we can use the whole litany list. Violet's more antimicrobial, but the combination balanced the immune system, the autonomic immune system, and we had this phenomenal patient outcome. We've got some other studies, which I'll be quiet on what we did. But when people see them, I'm just going to say this, guys, get ready to get your hair blown away. Use some hairspray. Some really, really good stuff coming down the pike. To speak about some really, really good stuff, what else are you guys doing to get the word out there?
A couple of things which we're doing, which are two of my passion projects for sure. And you were involved in one recently, the live stream. So obviously COVID changed a lot for everyone. And through that change, we started doing a lot more through our webinars. And we really wanted to figure out how to get the seminars on that level as well. So we got very fortunate. Our Representative Penny Sneed, who's been with us for many, many years now, her nephew, Brooke Sneed, is a Emmy award-winning videographer. So she connected us together. We started talking about it, and we said, no, we can bring these seminars, which are amazing, taught by you, Rob, taught by Dan Murphy, Trevor Barry, Brandon Brock, Jerome Raruka, just wonderful doctors, right into someone's living room or into their office. So what we started doing just over a year ago is we will still host the seminar live at a location. These are CE accredited seminars, 2-day seminars. And this amazing videographer, Brooke Sneed, he comes in, sets up multiple cameras, looks like a computer war room from a military base or a pro football draft room. It's awesome. And he is then bringing this seminar right into doctors' living rooms, right into their offices, so they can enjoy it there and see it remotely all across the country. And with that change in COVID, the majority of states now and 10 Canadian provinces are CE accrediting these events. So doctors are able to enjoy this and get their CEs from all over the country.
Yeah, it was great. I really want to add to that. First of all, I want to make sure you told everybody it was national and international, because I go internationally. People said, I saw you on the live stream. So, yeah, you're able to like chill out, have your egg whites in the morning, and then have your cauliflower pizza a little bit later at lunchtime. But they're able to get as close to you can in your hands. And a couple of people have commented that in some ways, when, we don't want to kill the people coming in person, they were able to see where my hands were and how I was utilizing the laser even better because it was magnified. So if you're in Missouri and you can't come to New York and hang out with me, it's great. Or the reverse is true. Got a question. You stimulate some interest. Where do you go to register for one of these live streams?
Yes. So definitely you can hop on Erchonia.com. That's our main company website. And on there, it will have an education or seminar page. You click on there and you'll scroll through and you'll see the different events we do, and it'll be designated as a live stream. And typically we're doing those every other month on the chiropractic side. But now as we're doing, like this last week, we did a veterinary live stream and an emerald live stream. There's almost one going every month now throughout the rest of the year. So we would love it if you guys would join us for those.
Well, that's great. I mean, the live streams are the way to go. I think that's exciting. You also do a lot of webinars. You're doing some lives now. You're on a podcast. I'm so proud of you.
Thank you. Thank you. I'm coming up to the game now.
I just had another question. Somebody said, I am not a doctor. It's a little difficult for me to get to the doctor 3 times a week like he prescribed. How can I get laser therapy in my home?
So the best way you can do that is talk to the doctors that you find on our website under the physician finder, or one you're already working with. And what a lot of them now are doing is promoting what they call a rental program. So a lot of doctors saw that, okay, patients have a serious need for these lasers, but like this person that just asked the question, Rob, they can't get to the doctor that often. They live far away. It doesn't work with the busy schedule. So the doctors are willing to accommodate their trusted patients, the ones that they know and who they've worked with for a while, to go, okay, I'm going to get you this laser under prescription, we're going to train you on how to use it and program in the things you need for home care. And then you take it home with you for 1, 2, 3, 4 weeks. And then the patients can start using it on a daily basis, which obviously, if you're using it once a week, you're going to see some great results. But if you have something serious, something chronic, you have an acute injury you're trying to get on top of, using it once a day or even multiple times per day is going to give you better outcomes.
Absolutely. You know, I'm not here on the weekend, so that I actually have a weekend rental, something a little different. So I'm here Monday through Thursday. So I want somebody to get an extra laser treatment. It works really well. We got a question. Can patients buy a laser?
So they would have to do it under the prescription of a doctor. Because once again, all Erchonia devices, with the exception of the Zerona, are prescription based. So they have to come through a doctor. Now, the Zerona, which is for non-invasive body contouring, that's the one laser that we got an over-the-counter clearance for. So technically, people could buy it for home use, but more often than not, that over-the-counter clearance comes into play if a business such as a gym, tanning salon, a weight loss center would like to add another tool to their repertoire, especially for body contouring and fat loss, they can do that.
We've got a question. And I told you, the beauty of live is you're going to get these questions. When you can't get these questions. Any risks or contraindications to low-level laser use by an Erchonia laser?
So with an Erchonia laser in our clinical trials, we have not seen any recorded side effects or adverse events, but we are going to be erring on the side of caution as a manufacturer. So when you're looking at your owner's manual with the laser, there's some basic contraindications, pregnant and breastfeeding women, cancer, open wound, those kind of things, which are pretty standard for all your medical devices, would still apply for an Erchonia laser.
Somebody just texted me in a question. They said, what's Erchonia mean? Or how'd you come up with the name?
So it's something our owners came up with. It's Latin for the healing light.
Should have known that, correct?
Right,
Somebody
right.
else, they said, what laser is over your right shoulder, Joe?
So the laser over my right shoulder is the Zerona. That's the one I was just talking about with the over-the-counter clearance and the body contouring. That one to me is definitely my baby because I've had a lot in my career here at Erchonia where I've been a part of the over-the-counter research. I got to be a part of the protocols for training. So that laser means a lot to me. It's been a big part of my career and my advancement at the company.
So right now, what is the number one laser that the doctors are requesting for patient care?
It's got to be the EVRL. I think a lot of them may want to send the Accelerate home with a patient because it's what we would say is the starter model laser. So the doctor's going, the EVRL is my baby. I don't want it to go anywhere. But they end up getting multiple EVRLs or upgrading on their base station to multiple EVRLs because that red-violet combo is hands down become the most popular laser. And the patients know and they want that when they're using it for home care.
I just got another text. Sorry about that. Guys, FX635, 405, EVRL. Can you give me a little bit more of an explanation? So I think we need to, before we leave, EVRL, Erchonia violet red laser. I think they want to know what the red light does, what the violet light does, that it's, 2 diodes versus 3 and all that kind of stuff. So if you give a brief overview of them all, one more time.
Absolutely. So the Accelerate, it's a handheld unit about the size of a smartphone, 2 red diodes. EVRL, same exact setup, about the size of a smartphone. It's a handheld unit with 1 red and 1 violet diode. When it comes to the FXs, those are the big premier pain management lasers. So they're fully automated laser scanners. They're positioned over the table. You press start, the lasers are spinning. They're big, impressive units to have in a clinic, and they're completely unmanned. When it comes to the FX635, you have 3 red laser diodes. 635 nanometer. And when it comes to the FX405, you have those same 3 red diodes, but also you incorporate one of the violet diodes, which is 405 nanometers. So that scanner has 4 laser diodes sweeping the treatment area all at one time.
I just got a question. They said, "Hey, Rob, how many lasers do you have?" I said, "I have 12, and I'm happy to take a picture in a room of all of them together for you guys." We have another question. "Hello, I was wondering if you have any supporting evidence to suggest which laser has better outcomes for wound healing treatments." You know, Joe, before you grab that, let's tell everybody at headquarters they can attach different articles and some of the list of FDA clearances into the comment section in my Facebook and my LinkedIn, so everybody has access to that.
Yes, that's correct.
So we'll do that afterwards. We'll just put it in the comment section. So one more time. "Hello, I was wondering if you have any supporting evidence to suggest which laser has better outcomes for wound healing treatments."
Yes, and that would be something where, once again, I would hop on Erchonia.com. We do have a research tab, so that'll show the different research articles you'd want to reference. And then also, it's becoming a lot more of a modality, if you will, a treatment that doctors are using. So I also suggest anyone interested in research, go on PubMed and look up laser, non-thermal, 635 nanometer, 405 nanometer, and you'll start seeing all the different research and all the different applications out there for low-level laser. Because I want people to know this isn't only what Erchonia is saying. This is public information. It's on PubMed, it's on clinicaltrials.gov, FDA.gov. There's a lot of wonderful information about laser therapy.
Without question. Speaking about PubMed, if you put in low-level laser therapy, there's over 11,000 hits.
Wow.
Now, just do your condition and low-level laser therapy and see PubMed populate. Now, so you understand, that's not a blog that sometimes I write. Those are peer-reviewed journals that are published. So there's a lot more weight given to them. Facebook.
And that's the key, Rob, if I can touch on that.
Yeah.
Like you said, peer-reviewed and published. One of the biggest things we want people to know here is you're getting the safest and most efficacious treatment out there. And it's not just what we say, because a lot of other people say a lot of things about Erchonia. Look at the research. Once you see that, we'll take and win the Pepsi challenge, if you will. Once again, dating myself with anyone out there, because that's important to us, that people understand that we are bringing them the best product possible. So doctors are comfortable treating their patients, and so people are comfortable using it on their families, their pets, their loved ones.
So I got a comment here. They said, "Wow, 12 lasers." Well, I kind of wanted the 13th, but I didn't like the number. So I'm waiting to get 2 together to hit 14. We actually have someone that has a question, and we field all questions. Mike Cairo has this. Now, I don't know if he has an Erchonia laser. So can you please clarify? Why does the area hurt afterwards blood supply? Well, I can tell you this. I'll answer that from a doctor perspective. When you use the Erchonia laser, there's no extra pain afterwards because it's photochemical. If he's using, and I'm assuming that particular chiropractor is using a hot laser, well, that's the whole point, not to use the hot laser because of the vibration, the increase, not the blood flow. The Erchonia laser increases blood flow without increasing heat. The hot lasers increase blood flow and heat is the byproduct of inflammation. And that poses a major, major issue. And that's why we want to avoid those hot lasers.
Thank you for answering, Rob.
No worries. So I got last question for you. How can they get in touch with you?
The best way is to email us. We have info@erchonia.com, ERCHONIA.com. And you can send any questions in there and we will take care of you. If you prefer to get someone on the phone, obviously you could give a quick Google search, but I'll say the number here, 888-242-0571. And you can call up and speak to us. We're happy to answer your questions and provide you with any information you may need.
I got a last thing. Somebody said on my laser group, anybody who's interested, come join my mastermind laser group. They said, would it be okay if we had a private little live like this with the laser group? Because they have a lot of advanced questions that they'd like to ask the two of us. So,
if you guys want me on there, I'd be honored to do it.
well, without question, we have to have you again. You've lit up what we call the question board. It's been my pleasure. I know you're really busy. I don't want to take any more of your time. Love to have you again. Joe, thanks for coming. I appreciate it.
Thank you. I had a great time, everyone. And one last thing, we didn't get a chance to touch on it, but I'll mention it quickly because it's my other passion project. And out of the next episodes we're recording, Dr. Rob's going to be doing 2 of them. If you guys haven't already, please check out our new podcast. It's called The Laser Light Show. Once again, The Laser Light Show. It's now up on Apple and Spotify. A lot of great doctors, a lot of great information, and we would love to have you guys tune into it. So thank you for your time. I look forward to doing this again and also doing one to the private group. I appreciate the offer.
And there you go. We're starting to get the thank yous rolling in. Look at this. They love you. Thank you, Mia.
Thank you.
So everybody will see Joe. Hang on. We'll see you in a moment. Everybody, Dr. Rob Silverman, always yours in health.